To be back in Hamilton alongside many candidates, particularly our Liberal candidate for right here in Hamilton Centre, Jasper Kurjavsky. Jasper has always been passionate about social justice, from representing refugees as a lawyer to fighting for the victims of gender-based violence as a prosecutor. Jasper is ready to be a strong voice for his community. But first, we've got an election to win. On October 21st, we all have an important choice to make. We have to decide what kind of Canada we want to build together. And the choice could not be clearer. Liberals won't reward big polluters, gun makers, and the wealthiest 1% with a tax cut. But the Conservatives will. They always do. And the fine print? Well, they'll pay for it by cutting the public services you and your family rely on. You can set your clock by it. Exhibit A, Doug Ford. On the campaign trail, Conservative politicians love to say they're for the people, but we know what happens once they're in office. Families here in Ontario have seen just how far they're willing to go to help the wealthiest few, how quickly they will make cuts to public health and to the services people rely on most. They don't understand that you can't cut your way to prosperity. Doug Ford threatened cuts to Ontario's autism program. He cancelled an out-of-country OHIP program. And he cut Ontario's Pharmacare program that was focused on the needs of kids and young adults. Rewarding the wealthy and big polluters and making life harder for the middle class. That's what Conservative politicians do. And now Andrew Scheer wants you to double down on Conservative politicians. Twice the tax breaks for big polluters and the wealthy, and twice the cuts for you and your family. There aren't enough teachers offering courses in Ontario this year for grade 12s to put together the credits they need to graduate. Think about that. That's what happens when a government focuses on buck a beer. I'm not for doubling down on the Conservatives. I'm for moving forward with you. That's why we decided to invest in people and in their future. And we're off to a great start. But we also know there's a lot more work to do. Like many Canadians, I'm proud to live in a country where we have universal health care. But I also know that our system is not perfect. Right now, too many people are falling through the cracks. Parents and children who have to spend the night at the ER because they don't have a family doctor. Injured workers who can't afford the medicine they need to get back on their feet. Teenagers struggling with mental illness who don't know there are professionals who can help. Widows who can't afford home care. The list goes on. And in a country like ours, that's unacceptable. Every Canadian, no matter where they live, who they are, or what they do, should receive the care they need to stay healthy. That's why during our first mandate, we took some meaningful steps to close the gaps in our healthcare system. To help reduce wait times and improve patient care, we negotiated a new health accord with the provinces and territories. We also brought in the most significant changes to drug pricing in nearly 30 years, which will save Canadians approximately $13 billion over the next decade. And we set up an advisory council to lay the groundwork for National Pharmacare. But we know there's lots more work to do. People are tired of looking for doctors, tired of spending hundreds of dollars on prescription drugs, tired of fighting a system that should be helping them. So today, we're announcing what a re-elected Liberal government will do to strengthen our healthcare system. Dans un premier temps, un nouveau gouvernement libéral amorcera des négociations avec les provinces et les territoires pour établir des normes nationales en matière de santé mentale. En ce moment, la qualité des services peut dépendre de l'endroit où vous habitez ou de l'hôpital auquel vous allez. Les gens qui sont aux prises avec des problèmes de santé mentale et qui habitent loin des villes n'ont pas énormément d'options. Ils doivent se déplacer pour recevoir des traitements Et dans un pays aussi grand que le nôtre, les distances sont souvent considérables. Et pour ceux qui sont dans les grandes villes, voir une psychiatre ou trouver un psychologue spécialisé, ça peut prendre pas mal de temps. Du temps que trop souvent les gens n'ont simplement pas. Dans les cas les plus sévères, recevoir un traitement peut faire la différence entre la vie et la mort. In the last 4 years, we've made investments to improve access to treatment and address the stigma of mental illness. But it hasn't been enough. Not for the thousands of people who lose their life to suicide, not for their loved ones, and their friends, and their communities. Right now, there are people in this country who are dying because they don't live close enough to a hospital. Others are struggling because they're on a wait list to receive treatment. There are just too many Canadians who can't find a doctor. So we're going to strengthen the Canada Health Act so that the full range of mental health services are available to every Canadian in every province and in every territory. Having access to the right doctors and the right treatments can make all the difference. Where you live, how much you make, or who you know should not have any bearing on living a healthy life. A re-elected Liberal government will also work with the provinces and territories to ensure that all Canadians have access to a family doctor or a primary health care team on a regular basis. To have the same doctor or nurse practitioner to do your yearly checkup and monitor your health over time can help prevent illness. They make sure you've received all your shots and conduct routine tests, so if something's not right, you can get the right treatment right away. And if you have a family physician, you may not need to spend as much time in the ER, which in turn reduces wait times. To do this, we will start with an investment of $6 billion over the next 4 years to support a stronger Medicare system and public health care. Finalement, nous allons travailler avec les provinces et territoires pour mettre en œuvre l'assurance médicaments au Canada. En 2018, nous avons établi un comité consultatif qui avait pour mandat de conseiller notre gouvernement sur la marche à suivre. On sait que pour les gens qui doivent prendre des pilules à tous les jours, le coût des médicaments représente un énorme poids financier. And for people who live with a chronic illness, a rare disease, or a complex condition like multiple sclerosis or cancer, the situation has only gotten worse. Increasingly, they need to take expensive, ultra-specialized drugs as part of their treatment. It's a huge financial burden on entire families, especially for those who are too sick to work. To lighten their load, a re-elected Liberal government will work with provinces and territorial partners to implement National Pharmacare. Under a re-elected Liberal government, we will work hard every day to make sure that no Canadian has to choose between staying healthy and putting food on the table. My friends, in the future, the federal government will have to negotiate with the provinces and territories, as it's always been the case, to reach new health accords. When that time comes, who do you want at the negotiation table, standing up to Doug Ford? Andrew Scheer, who follows Doug Ford's lead, or our Liberal team that will fight for you? I got into politics because I believe that all Canadians, no matter who they are, what they do, or where they're from, deserve a team that listens to them, cares for them, and fights for them. A team that puts them first. Together, we have built that team. And we've accomplished a lot these past 4 years, but the truth is, we're just getting started. On October 21st, Canadians have an important choice to make. Will we go back to the failed policies of the past, or will we continue to move forward? That's the choice. It's that clear, and it's that important. I'm for moving forward for everyone. David.
Is this working? Sorry, Prime Minister David Youngren from Reuters. You made clear that pharmacare is only going to happen after negotiations with the provinces and the territories. Given the fractious history of talks between the federal government and the provinces on a whole bunch of topics, including healthcare, you'll remember Paul Martin's experiences, what gives you any confidence at all that all 14 levels of government are going to be on the same page at the same time to even begin to push this through?
We were able to renegotiate health accords with all 10 provinces and 3 territories during our first mandate, including important investments in home care and in mental health care. But we know there's more to do, and part of that is moving forward and making sure that no Canadian ever has to choose between paying for groceries and paying for medication. And we've taken many steps on exactly that during this mandate to bring down the costs of prescription drugs, but we know there's more to do. And that's why we're going to have to negotiate with the provinces as recommended and as recognized in the expert report on the implementation of universal national pharmacare. So the question becomes for Canadians, who do you want negotiating with Doug Ford when it comes to your health? Okay. Nous reconnaissons qu'il y a bien trop de Canadiens qui doivent choisir entre leur épicerie et payer leurs médicaments. C'est pour ça qu'on a pris des mesures concrètes au cours des 4 dernières années pour réduire le prix des médicaments à travers le pays. Mais nous reconnaissons aussi que pour avancer sur l'assurance médicaments de façon nationale, il va falloir qu'on continue les négociations avec les provinces. Alors la question devient, qui voulez-vous voir négocier avec Doug Ford sur votre santé?
But secondly, how does it serve your interests to smack down Mr. Ford as you've just done when you need to be negotiating with him? Where's his incentive to work with you?
I think it's very clear that Conservative politicians have a track record of saying they are for the people and then delivering tax breaks to the wealthiest and cuts to everyone else. That is the choice facing Canadians on whether they want to double down on that Conservative approach or whether they want to choose forward. We're always going to stand up for Canadians, stand up for hardworking families who need help getting ahead, who deserve health care. And that's why when it comes to negotiating with the provinces, who do you want negotiating with Doug Ford? That's the question people have to ask themselves today.
Salima Shivji, CBC News. So the PBO has costed National Pharmacare program at $19 billion a year. This is just $6 billion over the next 4 years, and it includes access to a family doctor as well and the steps towards a pharmacare program. These are big, lofty promises that are very costly. How can Canadians trust that you can deliver on these things that we've been hearing so much about for so many years?
We promised $3 billion over 4 years in the 2015 election, and then went on to negotiate healthcare accords with the provinces that have made a significant difference in healthcare outcomes across the country, particularly when it comes to home care and mental health. But we recognize there's more to do. That's why we're putting forward a commitment of $6 billion over the next 4 years to engage with the provinces on these priorities that all Canadians recognize. Needing to be able to find a family doctor right across the country. Needing to be able to afford medications that are so key to healthcare in the 21st century. And needing to know that mental health supports and care are there when people need them. And yes, that will involve negotiation with the provinces. And the question becomes, who do you want negotiating with Doug Ford on the future of your health care?
But what do you say to people who say this is concretely not nearly enough money?
We know that there is always much more to do. And that is why we are putting forward concrete investments that will lead Canadians to be able to find a family doctor, that will remove that impossible choice between groceries and medications for so many Canadians. And it will provide mental health care for more Canadians right across the country in times of crisis. But we know that it does require work with and negotiation with the provinces. And again, that question for Canadians is, who do you want negotiating the future of your health care with Doug Ford?
Glenn McGregor, CTV News. Mr. Trudeau, I'm interested in your starting point for that negotiation philosophically. Do you believe that all Canadians should have exactly the same access to medicine they need? Or should some Canadians be able to get better access, more comprehensive coverage through employer plans? I mean, essentially, do you envision a one-tier access system in medicine or two-tier?
We believe in universal pharmacare as laid out in the principles of the Eric Hoskins expert report. But part of that report recognizes that it's not just the federal government that can drop in a national pharmacare program across the country, that it requires partnerships and negotiations across provinces and territories. And that's why the question that we have to come back to in this election on so many different things is, who do you want standing up for you? Who do you want negotiating with Doug Ford when it comes to your health care?
Yeah, just a quick follow. I mean, there's still confusion about this. Is this going to be a system where a government plan is replacing employer health benefits?
Right now, there are Canadians who are facing impossible choices between their groceries and their medications. And that means people choose to skip doses or they skip a meal. That is unacceptable in a country with as many opportunities and as many resources as Canada. That's why we need to move forward in making sure that everyone has access to the medications they need. Unlike Andrew Scheer, who does not think that we need to help Canadians afford their medications, we know that there is much more to do, and that's why we will be guided by the principles laid out in the expert panel on the expert report on pharmacare, in our negotiations with the provinces, in our moving towards universal pharmacare, which is something we have already taken tangible and concrete steps on. But again, the question for Canadians is, who do they want negotiating with Doug Ford on their future? Juste la fin, qui voulez-vous négocier avec Doug Ford sur votre système de santé? Nous savons que Andrew Scheer ne croit pas que les Canadiens font ces choix impossibles entre payer l'épicerie ou payer les médicaments. Nous savons qu'on a du travail à faire tous ensemble pour avancer selon le rapport d'experts sur l'assurance médicaments, et nous allons travailler avec les provinces exactement là-dessus.
Karina Roman, CBC News. Just let's be extra clear here. There's a difference between national and universal pharmacare. National, what the PBO costed for national because it included co-payments from insurance companies. Then there's the universal. You guys are using this term interchangeably. We'd like clarification on what exactly are you promising Canadians, who would be covered and who would be not by a pharmacare program under the Liberals?
The expert report on pharmacare that we commissioned, that looked at different models, that looked at different initiatives, that looked at services and options across the country, made a series of recommendations to move forward to make sure that nobody ever has to face those impossible choices between paying for groceries or heating and paying for the medication that they need or their loved ones need. And that is the report that will guide us forward. But we also know that no federal government can impose national pharmacare on its own. We need to negotiate with the provinces and territories in order to do that. And those discussions will happen. We have already taken significant steps on creating a Canadian drug agency, on moving forward with high-cost medications for rare diseases, and for lowering drug prices by $13 billion over the next 10 years. These are steps the federal government has taken already, and we are going to continue to do that in partnership with the provinces and territories to determine that model that flows from the expert panel, the expert report. But the question when it comes to those negotiations that are going to happen is, who do you want negotiating with Doug Ford when it comes to the future of your health care?
Hi, Morgan Lowry, the Canadian Press. In terms of this National Pharmacare, it's understandable that you need to negotiate with the provinces, but can you provide any kind of a timeline or any kind of a cost of what this the cost of bringing in this Pharmacare?
We are announcing today a $6 billion down payment over the next 3 years on implementation of National Pharmacare, on making sure that more Canadians, or all Canadians, have access to a family doctor or a healthcare team, and get better access to mental health services that we recognize are an essential part of healthcare right now. We know that the Canada Health Act needs to include clear standards and expectations for right across the country around mental health. These are the things we will be moving forward with. These are the investments we're going to be making in partnership with the provinces. And we were able, in our first mandate, to sign landmark agreements with every single province and territory on moving forward, on renewing our health accords, on investing specifically in mental health and home care. And this is the next step on that, in making sure the Canadians see the right future for their healthcare system. And that is the choice that people are facing, whether we continue to move forward or whether we go back to the Harper years by doubling down on Conservatives who believe in cuts.
You haven't costed the Pharmacare separately?
We are going to be continuing to invest in a better future for all Canadians and universal Pharmacare according to the principles of the Hoskins Report.
Bonjour, M. Trudeau. Vous avez fait beaucoup de promesses. Les conservateurs ont fait beaucoup de promesses. Des baisses d'impôts, ça se ressemble. De l'argent pour la santé, ça se ressemble. De l'argent pour acheter des maisons, ça se ressemble. La vraie différence entre les libéraux et les conservateurs, c'est quoi? C'est 200, 300 $ de plus dans les poches des contribuables?
Non, la vraie différence entre les conservateurs et les libéraux, c'est que notre approche n'aide pas les mieux nantis. Vous parlez de l'approche sur les baisses d'impôts. Bien, sous le plan conservateur, on a une famille qui fait 40 000 $ par année, qui aura moins dans la baisse d'impôts qu'ils ont annoncée qu'une famille qui fait 400 000 $ par année. Nous, on trouve que ce n'est pas juste. Alors oui, notre approche est meilleure pour les familles à faible et moyen revenu parce qu'on réduit leurs impôts en ne pas donnant davantage aux mieux nantis. Et par rapport aux investissements en santé, la question est très claire. Oui, tout gouvernement canadien va devoir négocier avec les provinces sur l'avenir de notre système de santé, mais la question devient qui voulez-vous être là? Qui voulez-vous voir négocier l'avenir de notre système de santé avec Doug Ford et les autres premiers ministres conservateurs?
Mais, M. Trudeau, vous faites des annonces, vous promettez des milliards, c'est de l'argent, c'est des cadeaux. Est-ce qu'il y a une vision derrière ça? Parce que pour l'instant, c'est juste des cadeaux. On a l'impression que vous achetez, chaque parti veut acheter le plus d'électeurs possible avec des milliards que finalement on n'a pas.
Nous, on a démontré un choix différent des conservateurs en 2015. Quand les conservateurs continuaient de proposer les coupures et l'austérité, nous, on a démontré, on a décidé d'investir dans les Canadiens. Et ce que ça a donné, les bons investissements dans la classe moyenne, dans les communautés, c'est la création de plus d'1 million d'emplois et on a pu sortir 900 000 Canadiens de la pauvreté. Cette vision d'investir dans ceux qui en ont besoin et pas dans les mieux nantis a aidé la croissance économique au Canada et surtout a aidé ceux qui en avaient le plus besoin. Les conservateurs proposent la même approche que Stephen Harper, avec des baisses d'impôts qui aident les mieux nantis. Ils ne vont pas aller chercher de l'argent chez les grands pollueurs. Ils vont protéger les manufacturiers d'armes. Ils vont continuer d'aider les 1% les plus riches au lieu d'investir dans la classe moyenne et ceux qui travaillent fort pour s'y joindre. Le choix est très, très clair dans cette élection. Est-ce qu'on continue d'avancer avec le Parti libéral ou est-ce qu'on retourne en arrière aux années Harper?
Hi, Mr. Trudeau. Marika Welsh with the Globe and Mail. Governing is about choices, but in this election, aren't you just offering voters all the candy in the candy store?
On the contrary, we have demonstrated over the past 4 years that an approach that invests in communities, invests in Canadians, is exactly the way to grow the economy. For 10 years, job creation, economic growth was stalled under Stephen Harper because he still believed that trickle down, that giving advantages to the wealthiest was the way to create economic growth. Well, he failed Canadians with his vision, and we demonstrated that we could both create over 1 million new jobs, most of them full-time, and lift 900,000 Canadians out of poverty, including over 300,000 kids, by investing in communities, by investing in Canadians, by investing in our future. And we did so in a way that remains fiscally responsible. Our debt continues to decline as a share of our GDP, and we continue to get top ratings from the international credit agencies. We have an approach that has worked for the past 4 years and helped Canadians in an uncertain world in uncertain times. Our approach is to continue to choose forward, and Canadians have a choice between returning to the failed Harper approach with Andrew Scheer or moving forward with us.
Abigail Beeman, Global News. This morning, Global News published a story showing some of the founding signatories to the People's Party of Canada have either current or past ties to neo-Nazi groups, Soldiers of Odin, far-right groups. In light of this, would you ask the debate commissioner to reconsider the decision to allow Mr. Bernier in the debate?
In the last election, Stephen Harper gamed the system around debates, cherry-picked which ones he wanted to do, which ones he didn't want to do. And we made a promise to Canadians that we would create an independent debate commissioner who would make the determinations around where, when, how the debates, and who would be part of it. And we trust David Johnston and his team of experts to make determinations removed from politics about who should be in the debates and how they should unfold, so that every Canadian has a chance to watch their leaders discuss, contrast their ideas, and make clear the choice facing Canadians right now. I look forward to the opportunity to call out Mr. Bernier for his intolerance and his approach that I think hurts Canadians.
Lucas Meyer, News Talk 910. Prime Minister, going back to the video that was obtained by Global News, you mentioned last week that it was during a rafting, during your time at the Whitewater rafting expedition, and it was a costume day. What exactly was that costume?
I am continuing to be open with Canadians about the mistake I made. This is something that I take responsibility for. This is something that I should have known better, but didn't. And I will continue to work every day to fight racism, to fight discrimination, to fight intolerance in this country.
With all due respect, Prime Minister, that wasn't even close to answering the question. What was that costume?
I have been open with Canadians. I will continue to be open with Canadians. I will continue to fight racism and intolerance every day. I take responsibility for the terrible mistakes I made in the past and commit to continue to fight against racism and intolerance every day.
Kevin Winter, Hamilton Community News. I'm just wondering, the Hamilton Steelworkers are looking to unseat your candidates. They believe that you have broken your promise.
Sorry, can you speak a little closer to the mic?
The Hamilton Steelworkers are campaigning against your candidates. They feel that they've been lied to, and with regard to the pensions, what do you say to them?
We faced a situation as a country where our closest ally and trading partner was imposing punitive tariffs on our steel and aluminum workers across this country, while at the same time threatening to rip up the most important trade deal we have, the NAFTA Accord that assures jobs and prosperity for millions of Canadians right across the country and indeed underpins our economy. We renegotiated those accords at a time of American protectionism and uncertainty and assured a good deal for Canadian workers and for Canadians right across the country. to have confidence in their future in this time of uncertainty. And more than that, we brought in countervailing duties to those steel and aluminum tariffs that brought the Americans to lift unequivocally those steel and aluminum tariffs. Our approach worked, even though Doug Ford and other conservative politicians said we should drop those tariffs unilaterally. That's not how you negotiate with the Americans. We demonstrated that we are standing up for workers, that we're going to continue to stand up for steel workers, that we're going to continue to work with labor as an essential partner in growing the middle class in this country, because that's what Canadians need. And that is the choice facing Canadians right now. Do we continue on an approach that has protected Canadian workers right across the country, or do we go back to the Harper years?
National Post. You talked about needing to redouble your efforts to fight racism and intolerance in light of these photos that came out. Have you considered altering your wait-and-see approach on Bill 21 in Quebec in defense of young women who want to be police officers, want to be teachers who are already leaving the province?
Yeah. We have a situation where Quebecers are taking Bill 21 to court. They are defending the Charter of Rights and Freedoms the way the Charter is designed. It is there to protect Canadians from laws they feel are unjust. We are watching very carefully as that process unfolds. We will continue to make determinations around next steps. But as I have said many times, I'm opposed to any law that restricts Canadians' freedoms, that tells someone what they should or shouldn't wear. I believe in defending people's rights, and I always will. Merci beaucoup tout le monde. Thank you so much.